MS is probably the greatest success story in neurology. We've developed multiple disease-modifying therapies that decrease damage to the central nervous system. That started in 1993. We have multiple options right now. We've transformed the face of MS. So in my opinion, the majority of MS individuals, if they get on appropriate treatment early and are followed well, will be able to have a normal life. It does not mean that there aren't missing pieces. We don't have good treatments for progressive MS, which is the most disabling form of MS, and we certainly don't have meaningful CNS repair strategies that can improve fixed deficits. Every major neurologic disease is missing CNS repair strategies.
Their patients give them the best care?
Well, I think it's increasingly clear that early treatment is key. So you need to diagnose early. You need to make sure the diagnosis is correct, because there's a misdiagnosis rate in MS, unfortunately, and you need to get people on appropriate treatment early and follow them closely so that you optimize that treatment approach. You also cannot ignore steps to improve CNS repair. You also don't want to avoid steps that would enhance CNS reserve, and by that I mean you really want people to have healthy lifestyle choices, follow a wellness program. If there are comorbid diseases, then make sure you identify and make sure that you explain how critical it is to optimally manage them, because one of the issues of MS can be thought of almost as accelerated aging. All these other, like poor lifestyle choices, not following a healthy lifestyle, comorbid conditions that may not be well checked, are assaulting CNS reserve, and that person is not going to age as well. Superimpose MS on that, and they're really not going to age as well. So that more global approach to therapy is very important. So the one that has the biggest buzz currently, and there is no available treatment for MS, are the oral BTK inhibitors. They hit B cells, they hit myeloid cells, including monocytes, macrophages. All of the major BTK inhibitors being studied in phase 3 trials in MS are CNS penetrant, so they can also hit the microglia. So they're in trials for relapsing MS and more limited phase 3 trials in progressive MS, both primary progressive, there are 2 trials, and not active secondary progressive, there's 1 trial. That's a big gap. If these oral agents were able to better treat progressive MS, then that would be a key advancement. They're all being studied in relapsing MS. There, the field is much more competitive. We have good treatments, but if these oral agents came close to the efficacy of some of the monoclonals that we have, and perhaps had better side effects, let's say, then they would be used also for relapsing MS, I think. So we'll wait to see. The first readout in phase 3 relapsing trials is going to be by the end of this year.